Hi, and welcome to CSF's Daily Highlights, Day 1 of ACR 2021. My name is Leonard Calabrese. I'm a professor of medicine at the Cleveland Clinic. And over the course of the next 4 days, myself, Professor Grace Wright, we're going to bring to you highlights from key posters and presentations from this conference. So some of today's most interesting sessions discussed clinical outcomes in a number of non-RA topics. And there are also two highly topical sessions covering COVID-related themes, something I'm particularly interested in. I want to draw your attention to. We'll open our daily highlights with 4 abstracts describing studies involving psoriatic arthritis and Still's disease patients. And of particular interest was a study by my good friend Vibeke Strand and her colleagues who examined health-related quality of life questionnaire data from a phase 2 trial of deucravacitinib in patients with active PSA. They also assessed the impact on clinically meaningful and significant improvements in patient quality of life over the 16-week study. So deucravacitinib is an agent in development. It is an oral selective inhibitor of TYK2. And this phase 2 trial enrolled 203 psoriatic arthritis patients who had been failed or were intolerant to previous therapy, including conventional DMARDs and one TNF inhibitor. So a well-treated group. Patients were randomized to 2 doses of the active drug or placebo. And the key results show that at week 16, the adjusted mean changes from baseline in SF36, both physical and mental scores, were significantly improved with active drug versus placebo. And when you looked at this data more granularly, you saw 5 of 8 domains with deucravacitinib 6 were improved. And at the 12 milligram dose, 6 of 8 domains were improved. So at this early stage of development, we can say that PSA patients receiving deucravacitinib reported clinically meaningful and significant improvements in health-related quality of life, in addition to physical functioning and pain. So staying on this topic of PSA, Bissett and colleagues examined the impact of early pain improvement in patients with active PSA. So data from the SELECT-1 PSA study was evaluated to investigate correlations between pain and meaningful improvement to other patient-reported outcomes. So the background of this is that, pain identified by GRAPPA and OMERACT working group is a core domain in PSA, but it's often uncontrolled, especially in patients who are failing non-biologic DMARD. So they took the SELECT-PSA1 data set and to see if meaningful improvements in pain was associated with other PROs. And a summary of this is that there was significantly greater proportion of patients had meaningful pain improvement with upadacitinib or adalimumab compared with placebo, starting as early as week 2. For those with meaningful pain improvement at week 24 versus those without, a significantly greater proportion reported values greater than the minimal clinically important difference in all PROs. So we can say that overall, meaningful pain improvement is closely linked with meaningful improvement in other outcomes of PSA. So I think that is intuitive, and I think that more work needs to be done. The final PSA study I've chosen for today was by Philip Meese and colleagues on a phase 2 controlled clinical trial investigating the efficacy and safety of brepocitinib. Improvements in quality of life were assessed along with disease activity and adverse events through week 52. So this drug is a small molecule which hits TYK2 and JAK1. It's already a topical drug, now moving into oral clinical trials for plaque psoriasis, PSA, and beyond. This phase 2B trial randomized patients at 2 doses of this drug, 30 and 60 versus placebo, in 218 patients with PSA. So the key results were at week 16, there was a significantly higher proportion in the active drug group achieving ACR 20 as early as week 2 and continuing to increase by week 16 and maintained to week 52. Overall at this time, this new drug, it looks like a JAK inhibitor, but it included cases of serious herpes zoster and changes in lab. There were no MACE, BTE, or deaths. So at this early time, this drug, brepocitinib, demonstrated superiority to placebo across numerous PSA domains and with a safety profile that looks like a JAK inhibitor. So more to come. Shifting our focus away from PSA, Gillard and colleagues discussed an interesting but very small 7-patient retrospective study looking at JAK inhibitors to treat refractory adult and childhood Still's disease, with the aim of evaluating risk-benefit ratios of treating this tough disease, which might allow reductions of steroids. And so let me show you this data. You know, the background of this is that juvenile and adult Stills that are refractory to steroids, this is a scary disease, carries a lot of morbidity. The options here narrow greatly. Both of these diseases carry risks of transforming into MAS. So they looked at this retrospective study based on a survey of French hospitals, and they found 7 patients, 5 adults, 2 kids. From these, baricitinib was used in 4 patients. 1 later switched to upadacitinib, 1 ruxolitinib, and then 1 with tofa. Reviewing this, they came out with a global assessment of whether patients were responding or not. And no complete responses were observed, but there were partial responses, had an average of 63%, and patients with no response were able to reduce steroids by 65%. So there's something there with this. JAK intolerance was excellent, but 1 developed an organizing pneumonia and discontinued. So the conclusion from this very tiny study is that it may have a role in some patients with refractory Stills, but probably not likely to be effective as monotherapy. And additional data is clearly needed to elucidate its role and possible mechanisms in this disease. So I'd like to round up today's highlights with JAKs and COVID-19 infections. So many ways to think about this a combination. JAK inhibitors as baseline therapy in patients with IMIDs who develop COVID, or the possibility of using JAK inhibitors to treat COVID in the hyperinflammatory phase. So finally, Haselli and colleagues compared the impacts of JAK inhibitors and TNFs on outcomes of COVID-19 and looked at confounding factors. And this study described the outcomes of SARS-CoV-2 infection in patients on these drugs. Again, they mined the German registry for inflammatory diseases and looked at the course and outcome of the infection. And again, no surprises to me, moderate and high disease activity before infection was more frequent in JAK inhibitor patients because we reserve these for severe patients. CVD and hypertension were also more frequent in patients receiving JAK inhibitors. It's a little distressing now with new warnings coming out, but this is over the past several years. Hospitalization was needed in 1/3 of patients treated with JAK inhibitors and 13% of TNF inhibitors. Oxygen required in 25 and 7% respectively in those groups. 8 fatal cases in JAK inhibitors, no fatal cases in TNF. So consistent with Rheum COVID Global Alliance data, JAK inhibitors appear to carry a greater risk for COVID-19 than TNF, and TNF safety has been reaffirmed in recent publications. So it's good to see at this meeting these type of data. So this concludes our first set of highlights for ACR 21. There's so much more there, but these are just things that caught my eye. I hope you enjoyed our roundup of the most interesting topics of the day, and I hope you come back tomorrow. My good friend and colleague, Professor Grace Wright, will take you through the highlights from day 2. In the meantime, make sure to download our ACR 2021 highlights brochure. It really has all the abstracts I think that you want to see for a closer look. That just leaves me to say thank you for joining me today.